Perfect. I did not hear any friction rub. The next thing that we're gonna do, we're done with auscultation. We're gonna be percussing, and what we're gonna do is we're gonna lightly tap on my patient's stomach in all 4 quadrants. On the stomach, which should be hearing tympany, which is the tympany sound is due to air in the stomach, which is normal. And over the liver and spleen, we should be hearing a dullness. If the person's stomach is distended, there should be a hyper resonance. So we're gonna start in the upper right quadrant, and we're gonna move clockwise around. Okay. Okay. The next thing that we're going to do is percuss the span of the liver and note the measurements. And we begin this by starting at the lower right quadrant, and we're going to move up as we percuss. And we're going to listen for when the sound changes from tympany to dullness. And where it changes to dullness, that would be the lower edge of the liver. Then we're going to do the same thing starting from the upper chest and percuss down to where we hear dullness again, and that's the upper region of the liver. Okay. Okay, so this is my lower region of the liver. I'm going to mark it, and then I'm going to again start at the upper chest and move down. Okay. So this is where I note I heard the dullness as I moved down the chest, and I marked the two locations, and the span should be between 6 centimeters to 12 centimeters. And from the spacing of my finger, it's within that range. So that's normal. If the liver was enlarged, the span would be wider, bigger, and with my patient, it's not. So she is, it's perfect, it's normal. The next thing that we're going to do is percuss the spleen. We're going to begin behind the mid-axillary line. We're going to move down and listen for changes from resonance to dullness. The span of the spleen should be about 7 centimeters. And if there is enlargement, of course, it will be outside of that span. So I'm going to move over to the left side of my patient at the mid-axillary line, and I'm going to start percussing. Okay, so I heard dullness right here, and that is within the 7 centimeter span for the spleen, which is normal. Okay, the next thing that we're going to do is we're going to do the blunt percussion of the liver and kidneys. I'm going to have my patient sit up with her back facing me. Okay, and I am going to tap on her, strike her back, and see if there's any tenderness. So I'm gonna place my left hand flat on her back, on her left rib, and I'm gonna strike it, and then I'm gonna do the same thing on the other side. Okay, so the reason why I'm striking is to see if there's any sign of tenderness, and that would be an indication of inflammation or infection. Now, my patient, did you have any tenderness? So my patient does not have any tenderness, which is what we want. If there was any tenderness, like I said, it will be a sign of inflammation or infection, or in terms of the kidneys, it would be pyelonephritis or hydronephrosis. So that we had a normal result for that one. I'm going to have my patient lie back down. And now we're going to do palpation. We're going to use two methods. We're going to do light palpation and deep palpation. When we're palpating, we're going to be looking for masses, tenderness, swelling, or bulges. With the light palpation, we want the stomach to be non-tender. We want it to be soft, normal, and we're going to look at the patient's stomach as we're going to look at the patient's face as we're doing the palpation to make sure there's no guarding, or to make sure there's no, we can tell based on her expression if there's any tenderness as we go along with the palpation. Okay, so with the light palpation, we can use one hand, but with the deep palpation, we're going to use both hands. When we're doing the deep palpation, we are pressing down about 5 to 6 centimeters, and we're checking for severe tenderness. There might be some mild tenderness over the xiphoid or aortic cecum or ovaries, but with severe tenderness, it could be a sign of trauma, a peritonitis, a tumor, or enlarged diseased organs. So now we're going to do the deep palpation. Are you having any tenderness? Perfect. So there was no tenderness felt by the patient. So now we're gonna go to the next. Step, which is we're gonna palpate the aorta. We're gonna use the thumb and the first finger to palpate the epigastric region. Okay, and what we're feeling for is for moderate pulse or a strong pulse, which is normal. But if there's a bounding pulse, it could be an indication of aortic aneurysm. So we're here at the epigastric region, and we're gonna feel, palpate for pulse. And that is normal. I have a strong pulse. No, it's not bounding. So we'll move on to the next part, which is bimanually palpating the liver. And we're going to start with the liver. What we're going to do, we're standing on the right side of the patient. We're going to place one hand under the patient and one hand above at the 12 rib. So we're going to put your arm out here for me. So I'm going to put one hand under the patient and the other up here. And I am going to press down and up to see if I can feel the liver. I do not feel the liver. It's which is normal. You may be able to feel the edge of the liver, but it's normal if you do not feel it. If you do feel in the liver and it's hard and firm, it could be a sign of cancer. So I did not feel it, which is okay. So we're gonna move on now to the spleen. We're gonna again stand on the right side of the patient, and then with our left hand, we're gonna reach under the patient and use our right hand on the top, okay? And pull up. And we're gonna ask the patient to inhale. Take a deep breath, inhale. Okay. Okay. I did not feel the spleen, which is normal. Most of the time you should not feel the spleen. If you do, it is a sign that it's enlarged, which could be a sign of infection, trauma, mononucleosis, or cancer. Finally, the last thing that we're going to do is we're going to palpate for the urinary bladder. If the bladder is empty, you should not be able to palpate it. But if it's full, it's going to be distended. It should feel soft. So we're gonna check that right now. So I did not feel the bladder. The patient. Do you need to go to the restroom? Is your no?
My bladder is full.
Is your bladder? No, I did not feel it, so it shouldn't be full.
Okay.
Okay. So yeah, that concludes the abdominal assessment. I want to thank my patient, and thank you so much.